Hi friends, once again welcome back to my channel Mugambika Nursing. Friends, in the previous video we discussed questions from community health nursing. We can continue community health nursing questions. Today's first question, commonest occupational cancer is options. Option A lung cancer, option B bladder cancer, option C leukemia, option D skin cancer. This is one of the previous year questions. So commonest, which is the commonest occupational cancer? It is skin cancer. Option D is the correct answer. And the next question, micropolysporaphyne is the agent for the disease. Options, option A byzinosis, option B farmer's lung, option C bagasosis, option D anthracosis. Micropolysporaphyne is a gram-positive bacteria. Inhalation of this bacteria causes farmer's lung. So here correct answer is option B, farmer's lung. Micropolysporaphyne is the agent for the disease farmer's lung. Move on to the next question. According to Factory Act 1948, maximum permissible working hours per week are options. Option A 48 hours, option B 60 hours, option C 72 hours, option D 54 hours. Our question is, according to Factory Act 1948, the maximum permissible working hours in a week or in per week is 48 hours. Option A is the correct answer. And the next question, this is also one of the previous year question. Who found the link between cholera and contaminated water? Options, option A Louis Pasteur, option B Edward Jenner, option C Ronald Ross, option B John Snow. And the correct answer for this question is option D, John Snow found the link between cholera and contaminated water. Move on to the next question. Malaria parasite was discovered by options. Option A Robert Koch, option B Leviran, option C Louis Pasteur, option D Ronald Ross. Malaria parasite was discovered by option B Leviran. Charles Louis Alphonse Leviran in 1980 who discovered the malarial parasite. Move on to the next question. Which of the following disinfectant is used for blood spill? Options, option A glutaraldehyde, option B phenol, option C ethanol, option D sodium hypochlorite. Our question is, the disinfectant which is used to disinfect blood spills are, it is sodium hypochlorite. Option D is the correct answer. Move on to the next question. Characteristic rashes present in measles is known as options. Option A Koplik spot, option B pleomorphic, option D vesicular rashes, option D flushing. The type of rash which is present in case of measles are Koplik spot. Option A is the correct answer. The rashes which is present in case of chickenpox are pleomorphic rashes. It is also known as dew drops on the skin. Dew drops on the skin is the characteristic features of chickenpox. Okay, and pleomorphic rashes are also the feature of chickenpox. And the next question, most serious complication of measles is options. Option A Koplik spots, option B parotitis, option C meningoencephalitis, option D nephritis. Our question, which is the most serious complication of measles? And it is meningoencephalitis. Option C is the correct answer. Move on to the next question. The minimum recommended level of residual chlorine in the drinking water is 1 hour for options. Option A 0.25 mg per deciliter, option B 0.5 mg per deciliter, option C 10 mg per deciliter, and option D 2.0 mg per deciliter. The minimum recommended level of residual chlorine in drinking water for 1 hour is 0.5 mg per deciliter. Here correct answer is option B. And the next question is, National Rural Health Mission NRHM initially started for till which year? Options, option A 2009, option B 2010, option C 2011, option D 2012. Here the question is, NRHM National Rural Health Mission initially started for which year? Till which year? Okay, and the correct answer is, it is up to 2012. Option D is the correct answer. The Government of India launched National Rural Health Mission NRHM on 12th April 2005. So the year is important. NRHM was launched in 12th April 2005 for a period of 7 years. Then after that it extended into 2012. So here that is our question. NRHM extend till up to which year? It is extend up to 2012. Option D is the correct answer. And the next question, IMCI strategy in mid-1990s developed by options. Option A, WHO, option B, UNICEF, option C, ICMR, option D, both A and B. IMCI means Integrated Management of Childhood Illness. Okay, this strategy in mid-1990s developed by WHO along with UNICEF. WHO collaboration with UNICEF. So here correct answer will come WHO and UNICEF, that is both A and B. And the main purpose of this scheme is to reduce death and frequency or severity of illness and also to improve growth and development. Okay, so this IMCI is developed by WHO and UNICEF and its main function to reduce death and frequency of severity of illness and also improve the growth and development. Move on to the next question. Janani Suraksha Yojana was launched on options. Option A, 1st April 2004, option B, 12th April 2005, option C, 12th April 2004, option D, 5th April 2005. The National Maternity Benefit Scheme modified into Janani Suraksha Yojana on 12th April 2005. So here our correct answer is option B, 12th April 2005. Move on to the next question. Breakbone fever is options. Option A, typhoid, option B, dengue, option C, malaria, option D, chikungunya. Which disease is known as breakbone fever? It is dengue. Option B is the correct answer. Move on to the next question. Black sickness is options. Option A, plague, option B, TB, option C, Kala Azar, option D, chickenpox. Which disease is known as black sickness? It is Kala Azar. Option C is the correct answer. On to the next question. Bagasosis can be prevented by spraying. Options. Option A, 10% acetic acid, option C, 1% propionic acid, option C, 5% acetic acid, option D, 2% propionic acid. Our question is, which spray is used to prevent bagasosis? And the correct answer is 2% propionic acid. Option D is the correct answer. Move on to the next question. Which one of the following are associated with bladder cancer? Options. Option A, nickel, option B, arsenic, option C, naphthalene, option D, lead. Our question is, among this, which one can cause bladder cancer? And the correct answer is, it is option C, naphthalene. Move on to the next question. Vector responsible for Japanese encephalitis is options. Option A, Anopheles, option B, Aedes, option C, Culex, option D, Mancinoids. Our question is, the vector which is responsible for Japanese encephalitis is Culex mosquito. Option C is the correct answer. And the next question. Life cycle from egg to a complete adult mosquito takes options. Option A, 2 to 6 days, option B, 7 to 10 days, option C, 10 to 15 days, option D, 14 to 21 days. Our question is, the life cycle of a mosquito, that is from egg hatches to an adult mosquito, takes how many days? That is the question. It takes about 7 to 10 days. Option B is the correct answer. Here we discussed community health nursing questions. Surely these questions will be helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle and also subscribe my channel and support me.